Hey there, I am Julie Duffy Dillon. I am a registered dietitian and an eating disorder specialist and supervisor. I am excited to answer this question. And if you would like to know more about the work I do, check out my podcast. It's called the Love Food Podcast. And if you are affected by PCOS and want ways to help manage the condition and live your life without diets, check out my course, PCOSandFoodPeace.com. So here's the question. I'm a 61-year-old woman who was told by my doctor that I am obese and pre-diabetic. Where can I find meal plans that won't send me bouncing between the two extremes? I hope you, are okay that I use the little bunny ears with obese. I find it to be a word that clients tell me feels quite disparaging, and so I just really only want to use it when I have to, like quoting research or someone else's question. So the one thing I will say that comes to mind to help where you are right now is to remember things like diabetes are mostly genetic. That's certainly research-based, and I don't think many people like to talk about it in that way because of the fat phobia that is just so pervasive in our world. And with that being said, there's many different ways to help promote health and manage things like prediabetes without dieting for sure. But as you are walking your path, because of how fat phobia is really so pervasive in the medical system, you will find yourself being pushed to lose weight. And keep in mind, something that's really important about that is that weight loss is not a behavior. It's not a behavior at all. It's just an outcome sometimes, and also they have no research to show a way for most people to change their weight long term. They just don't have that. There's no data that supports that. So as you're trying to find a way to promote health and help with maybe things like your blood sugar or your A1C, those are the things that they often measure with prediabetes, keep that in mind, that weight loss is kind of a moot point. It may or may not happen, and it's not going to be what is the end-all be-all anyway with helping to promote health, because research doesn't support that. And so from there, I would encourage you to ask your body what it wants. What does your body want? What does it need? What is it missing in order to promote health? And when I work with clients who have prediabetes, oftentimes I find that they're not eating enough and they have no energy, but yet beating themselves up because they're not moving their body through exercise. And I feel like the first step is ask your body what it needs, and then make sure you're actually eating enough. And it's hard to know what enough really is, because honestly, even as a dietitian, I kind of have all these calculations and things that I've been taught over the years, but I'm not in your body, so I don't know how much you need. Only you're going to know that. But if you sat down with a registered dietitian who specializes in eating disorders, that's someone who could help you really map together how much is enough for you to promote energy. Again, that's just a basic kind of first step that I would recommend. And how do you find those dietitians? Well, look for a registered dietitian that has the initials CEDRD after their name. Those are dietitians who have been working with eating disorders for many years. They've gotten lots of supervision, and I feel like for the most part, they are people that really are invested and can be trusted with helping without pushing diets or weight loss. And so be sure that they also are doing that too. So with that all being said, I think your body knows how much it needs in order to promote health. And you probably have heard of things called intuitive eating. That's a book that was written by two dietitians, Evelyn Tribole and Elise Resch. And that's a book that has, I believe it's over 80 studies now, maybe even more, on how relying on your body's own hunger and fullness cues and satiety cues promotes health and helps things like blood sugar and A1C long-term more than diets and things like that. So I want to check that out. While I say that though, a lot of my clients who are moving towards recovery from their eating disorder find that it's just too scary to rely on things like hunger and fullness cues. It can sound exciting, but also, again, very scary. And a lot of times it's important to find some guardrails, if you can kind of picture that, and a way to kind of just slowly go along your path with some guardrails. And sometimes it's setting up times during the day just to check in with yourself. My clients and I like to call it check-in times. So maybe every 2 or 3 hours, setting a little timer on your phone to go beep, beep, and to ask yourself, am I hungry right now? Am I thirsty? Do I need to pee? What am I feeling? I don't know, just have some basic kind of narrative with yourself to check in. And by doing this, it's so insanely simple and sounds like it doesn't do anything, but it does so much good stuff because it gets your mind and your body talking again. If you find you need more than that, again, that's where a professional like an eating disorder dietitian can be super helpful, because then they can help you just kind of like connect the lines even more. And I don't recommend meal plans. I feel like meal plans are going to be too rigid. I do like these check-in times that I will do with clients and just allow kind of that connection. And with that being said, what comes up for many people is this kind of, oh my gosh, what if I ate too much? And what's really important is that as a person is connecting with their body, it's going to be okay. Like, you have permission to figure out what your body needs. And sometimes it'll feel uncomfortable, and sometimes it'll be what you want it to be, and sometimes it's not. And in order to recover and promote health and do all the things you want to do just to live your life, to not be trapped by food anymore, you need to be able to have permission, unconditional permission to eat. And it's quite a journey. It's not something that's fast. It's something that can take years. And I appreciate that's a hard pill to swallow. And I think it's really good work. And you're worth that work. It's really worth it for you to feel like you can reconnect with food and reconnect with life and relationships. So that's all I have for now. I could go on and on forever, but I'm going to say goodbye now. But best wishes to you. I hope it helps. Take care.